Alright guys, I've been planning on making this video for a while. I wanted to show you the the one plan for healthy individuals that a lot of people are are getting are getting because of the premium, and I wanted to go over the description of what's covered, and you will understand why most people that are healthy opt for this particular private health plan. Now, I made a video a few weeks ago about the actual um, way you get this plan. It's through a company called LifeX Research, and I want you to do a deep dive into LifeX Research so you understand exactly how this is possible. And there is a lot of nonsense online talking about how LifeX is not a insurance company, which they in fact are not an insurance company. They are an employer. The way you get this coverage is they make you an employee, and they have you do surveys, which they pay you for, as your job. But the main reason LifeX did this is so they could put together a group health plan that people can participate in. So, enough about LifeX now. I do want you to watch the video that I'm going to put on the screen. I'll also put the link to the video in the description so you can do full research into LifeX so you know exactly what they are, who they are, and how they are able to offer this health coverage. So, that being said, let's go over to the LifeX program that most people, I'm going to say 70-80% of my clients, and I get probably 15, 20, 30 new clients every month that are opting for this coverage. So you do your own research. Uh, I've been offering this LifeX program for quite a while, and people are generally very happy with it. So, as you know, if you are not getting a subsidy for Obamacare or the Marketplace plans, your premiums went sky high, or you chose to drop down to a bronze plan and your deductible went sky high. And understand this, a deductible, especially a high deductible, is just an increase in premium. So if you have a $10,000 deductible, if you divide that by 12, you can essentially add that to your monthly premium, because you have to reach the deductible before you can even use the plan. So, here's the plan. I wanted to start first with the premiums. You see, if you're age 18 to 29 and you're a single, you would be paying $429 a month. For just you and your wife or husband, it would be $789 a month. Single parent, $779, and for the entire family, $1,000 a month. This is age-based and health-based. I'm going to go over the health questions for you to look at here as well, because you do have to be medically underwritten to be able to get this coverage. Age 45 to 54, single, $519 a month. Now, these are major medical plans. This is not an indemnity plan like an Allstate or Manhattan Life. These are real major medical group plans. Family plan, $1169. Husband and wife, $859, and even you can see the premiums for someone 55 to 64. We do a lot of these because sometimes a spouse goes on Medicare and the other one's left with no coverage. So very often, this is probably one of my top ones I do every month. So those are the premiums. Wanted to start with the good stuff first. Let me go back to the top. This plan is offered through LifeX. As I said at the beginning of the video, I am going to put a video on the screen at the end of this, and I do highly encourage you to look at it so you can have peace of mind that this is for real coverage and not read any of the propaganda being spewed on the internet. So it has a $500 deductible and a $1,000 family max out of pocket for a family. That comes into play obviously if you have a lot of kids. If it's just you and your wife, you each have a $500 deductible, which again is $1,000. But if you have 4 or 5 kids, the max deductible for the family is $1,000. Okay, so let's talk about in-network and out-of-network. All right, the network is PHCS, which is a national network. This is a PPO. So what does that mean? That means that if you are looking for a provider and you want to be in-network, they have to be in the PHCS Pro network. And I'll give you some information how to check to see what network or if your doctor or provider accepts it. But the most important thing about this PPO, unlike any other I've seen, is if you go out of network, because there are some areas of the country where PHCS doesn't have the strongest network. But out of network, since it's a PPO, you can go to any doctor, any provider you want, and they will have to accept the charges, but they are able to charge more. But look at the difference in what you pay if you go out of network. It literally says copay plus 10%. So let's say you went to your doctor and he's not in network, so you're not going to pay a $50 deductible, a $50 copay after deductible. You're going to pay $55. So it's $5 more. So essentially what this means is you can go to any doctor, any provider you want, and know what your copay or out of pocket is going to be. So you see, this is a true major medical coverage. The important thing to understand here is you pay the deductible first. So you remember what I said earlier. You divide the deductible by 12 and you're essentially paying that much on top of your premium before you can use the coverage. So 500 divided by 12 is a little over $40 more, is essentially what your premium is. Unlike Obamacare, where the deductibles, I'm seeing $9,200 deductibles. And then I made a whole video on Obamacare, so you can go back and watch that as well. So, specialists, urgent care, surgery performed in office. Again, if these providers that you're using, let me just get this sun blocked a little bit, because it is putting a glare on things. Just give me a second. There we go. That's better. So, you can see surgery performed in office, chiropractic care, 12 visits a year, therapies, labs, diagnostic testing. It's all there for you. Emergency room, there's a $1,000 copay after the deductible. Ambulance. Inpatient, you pay a $2,500 copay after the deductible. Inpatient surgery, $2,500 copay after the deductible, etc. And you can go down here. I'm going to scroll slowly so you can go through all the coverages. And I do encourage you to compare this coverage side by side with either your bronze plan or your silver plan or gold or platinum Obamacare plan that you may have now. Preventative care, very similar to Obamacare. There is no deductible. There is no copay. And this includes things like wellness exam, labs and immunizations, and there's a whole list of preventative items that are covered. Pregnancy, $2,500 copay after deductible. Other covered services like home care visits, durable medical equipment, diabetic nutritional counseling, which basically falls into the preventative care option. Prosthetics, prescription drugs. This is a basic prescription drug plan, so they are essentially encouraging you to use generic drugs. If generic drugs are not available for your condition, there is a process, a step process, where you can get higher end, maybe non-generic drugs prescribed. But I'll stop here for a minute about prescription drugs. Ever since Donald Trump put the Trump RX, which is a government website, the cost of prescription drugs is dramatic. I'm talking about ones that are not generic right now, is dramatically cheaper. There's also these companies that advertise on TV that I encourage people to use if you're going for a prescription drug cover. You have to pay for the prescription drug because it's not covered by your insurance. But essential prescriptions are covered in this plan as well. Finally, we're back down at the premium that we talked about at the beginning. As you'll see, it's a dramatic savings over any kind of Obamacare rates for people who are paying the full amount with no subsidy. Obviously, if you are getting an income subsidy, especially if your income is low, you can get Obamacare for a lot less premium. Now, the next thing I wanted to show you is, where did I put it? Here it is the health questions. Now, If you are not healthy and you cannot answer no to all of these questions, you need to stay on Obamacare, because the one good thing about Obamacare is there is no pre-existing conditions. You can have anything. You could be treating for cancer, kidney dialysis. It doesn't matter. They do not ask health questions. One other point I want to make here. If you are a small business owner and you have 5 people on your group, 5 people that you want to provide coverage for, you can get this type of coverage. It's not through LifeX, but it's very similar, with no health questions. Similar premiums and sometimes even lower, but no health questions. So if you're looking for coverage for your company and you only have 5 or 6 people working for you, and maybe one of them has a health issue, you can still get this type of coverage, but there has to be 5 on the group. The other thing is, for self-employed people that are just getting the coverage for themselves, if one spouse is healthy, the other spouse is not, or the spouse and the children are healthy, but the primary or one of the people on the family plan is not healthy, you can still get this plan, but you do it a little differently. Let's just use an example of the spouse has a serious condition and would not qualify for the LifeX plan. All you would do is you would keep the person that is not healthy on Obamacare, and then just go to either single coverage or the spouse with the children for the healthy part of the family, and the unhealthy person could stay on Obamacare. So you can split these up. Let me get back here to the health questions. I'm going to leave this on the screen. I want you to read through them yourself, and if you answer yes and read the preliminary part as well, it says in the last 12 months. Like I think it says up here, well, here on this part here, it says, is the applicant spouse, domestic partner, significant other, dependent children, or any other member of the household being treated for or expected to be treated for the following currently or in the next 12 months. That means if your doctor has said you need to have this done or you need to have that done, that takes you out of eligibility for this coverage. This is an important one down here too. You cannot be pregnant before you come on the plan, because the pregnancy would not be covered. And then this is also in the last 5 years. Has anybody applying for coverage seen a doctor? Well, I stayed in a hospital, or they're currently getting treatment or taking medication for any of the conditions listed above. This includes any current treatment, medications, or prescriptions. So when you're going through those questions, make sure you can answer no to them all, or do not apply for it, because you will not be covered. But if you're healthy, your family's healthy, you see here you can save a substantial amount of money. Now, if you want to call me or my company to discuss any particular situation, My information is on the website. I'll have the link to the website in this video description. Or feel free to put your questions in the comments section below about your situation, and I'll respond to them there. Thank you for watching this video. I apologize for not putting it up sooner because I get a lot of questions about LifeX. Again, I'm going to link the LifeX video so you can do a deep dive into them so you know exactly who they are and exactly how they are able to offer this coverage. Finally, like this video, subscribe, turn on notifications. The next few days I'm going to put a video up about health sharing and the health sharing company or organization that we use a lot of the time. Health shares, as you see here, health sharing is a hot topic right now, so I'll have a deep dive similar to this on the health share company, which is Zion Health Share, that we use most of the time here at Clear Choice Health Insurance.